Welcome back, everyone, to Einstein's Eyes. I'm Carl Rosen. I'm an oculoplastic surgeon and neuro-ophthalmologist in Anchorage, Alaska at Ophthalmic Associates. I'm thrilled to be here with my friend, Sam Korsmo. Sam is the current CEO of CallDR. It's a really interesting company, a company that leverages hospital-based physician on call. It organizes and really has transformed the hospital call process because it has taken really an outdated method of using doctors who are on call, and it's torn down silos between hospitals, allowing for the shared information so that another hospital can know who the cardiologist is on call for that evening and how to get a patient cared for, should they be suffering from a cardiac event, or an ophthalmologist with an eye problem, or an ENT doctor with a sinus issue, or a facial trauma, what have you. So just for our audience, EMTALA is the Emergency Medical Treatment of Labor Act of 1986 during the Reagan administration, and it made sure that patients on an emergency basis got triaged regardless of the ability to pay should they present to an emergency room. And this is really baked into the fabric of the American medical system. This is what makes American medicine so special, is that no matter what time of the day, 3 o'clock in the morning, 3 p.m. in the afternoon, you're going to get taken care of. If you cut your hand, if you have a problem with your bowel, if you have a neurologic event, you have an eye event, you're going to get taken care of by the emergency room. And you'll be seen by a doctor, triaged, and then you'll get referred to a specialist should that be needed. CallDR has done is it's spread that schedule. It's organized basically about 100 specialists so that you can see it on a piece of real estate on your screen and see what doctor is available for each specialty, say ophthalmology, cardiology, plastics, general surgery, neurology, neurosurgery, what have you, and allows the nurses on the floor to see, the emergency room doctors and staff to see other hospitals outside that may be smaller and don't have that particular specialty, so that patient care is improved. It essentially reduces the time that a doctor responds to a patient given a question from a nurse on the floor or a physician in the emergency room. And just for full disclosure, I used to own CallDR. I was the former founder and CEO, but Sam has taken over and he's done a great job. And we're looking forward to even more interesting stuff from Sam. But Sam, I've done a lot of talking. Give us a little bit of your background and tell us what's going on with CallDR.
Hi. Yes, thank you, Carl, very much for that introduction. I've been in healthcare for 35 years, have ranged from outpatient imaging to technological equipment support to management and administration of practices, and even over into what would be called the managed care systems within prisons. So I've done all kinds of different things. But anyway, I got involved with CallDR, first meeting Carl. And one of the things I found interesting is very few people have ever taken kind of the Amazon web page mindset and put call into directly that kind of framework. And so what CallDR has then grown from that point is we've implemented a way of taking EMTALA concerns and programming it in a way that you have an accurate 24/7, 365 knowledge of the doctor who is on call, to any stakeholder or anybody needing a specialist, or for that matter, we've even moved it over into what we call all hazard event management, which is a unique way of saying that we can provide rosters of doctors, nurses, staff within 2 to 3 clicks of a mouse over a multifaceted, multi-facility range of entities. And we've yet to find anybody that can do that to this point. So from a technological standpoint, we've kind of broken that barrier down. But coming back to what call is, I like to ask, as what I have found through all my research and involved with call for the many years, and as a practice manager within radiology, I always found that both staff and doctors, they weren't kidding when they say call is a four-letter word. That said, it's the accuracy and the ability of getting people who are on call, accurately calling them late at night and saying, hey, I need help or whatever. One of the things that I want to break down to the most easiest of ways is call doctor saves money. It actually makes money and it saves lives. And we really need to take a look at, in all honesty, the call structure is the most underinvested within hospitals today. And so we've taken call doctor to a whole different level and have provided that coverage in a very unique way that allows every stakeholder to have the most accurate, up-to-date information for those on call.
Thanks, Sam. That's great. Yeah. So again, just for the audience, I want to explain call. So EMTALA, as I said, is the Emergency Medical Treatment of Labor Act, implemented during the Reagan administration in 1986. But any physician that is on staff at a hospital who has been vetted by the medical staff is obligated to take call. And that goes for every specialty. And, it used to be that call was a voluntary offering by the physician because you practice in the community. And it was one of the gestures that doctors offered as part of their practice. And I took call for 25 years or probably longer. Recently, doctors have been getting paid to take call, and medicine has changed. It's kind of a new era. Less people are going into private practice, more people are being employed, and it's becoming a part of the workflow or the doctor's daily livelihood. And you don't take call every day for the month. You take call a couple days or maybe a week at a time, and you share it amongst the other specialists within your particular area. So for example, in Anchorage, we have 10 ophthalmologists that take call, and we share that experience. That we divide that up over the course of a year. ENT is the same way, neurosurgery is the same way. But the unique thing about call doctor is that it shares that schedule, because typically hospitals will not let another hospital know who's on call for, say, ophthalmology or cardiology or general surgery or neurosurgery. It's siloed, and call doctor has broken that down, and it's a new updated model of doing things. I think it's a more modern model, and I think it's better for patient care. And as I said, it reduces response times to get a clinical question answered, improves the patient experience, and reduces morbidity and potentially mortality, because you're getting a clinical question answered faster. And that's the fantastic thing about Call Doctor. It's really easy to use. It's on all the screens in the emergency room, throughout the hospital, on the patient floor, in the OR, so that at any time somebody can find out who's available for ophthalmology or cardiology or what have you. Right. Prior to that, you always had to call the emergency room. They had to look it up in their notebook, and things would change. Somebody would have an issue there. They forgot that their kid had a birthday party to be to, and so they were switching, and that was never really updated real time. But Call Doctor does that. And with the advent of artificial intelligence, it's even getting better and better, because things are now being collated and recognized and distributed more equitably. So it's really exciting times. The data management, the assessment of really who's getting called the most at what time of the day, you can sort of get this rhythm, and you can understand how to allocate resources too. And that's that's a really great thing also about managing the call data. There's a great company called Palantir that does that for the Department of Defense and for other industries. And call is starting to get that that view, that look, so that it's being assessed and examined more diligently. And I think for the betterment of healthcare and patient management. So Sam, just to wrap things up, is there anything you want to say? You want to tell us about where Call Doctor's going? What exciting things are available?
We have an array of a couple of customers that one they have an array of more rural type focused hospitals with larger, like level 2 trauma center. We're working on some customers that are statewide and looking for technologies for that. One of the things I wanted to just highlight in what Call Doctor has done, one of the big things that I think when I said underinvestment, it's a lot to do with time. I don't think many of the C-suite and management and administration people really understand how much time is spent trying to look up doctors, trying to make sure the calls get to the right people. One of the biggest things we found was because we've embedded a credentialing mechanism, we kind of keep a very streamlined aspect of how doctors know who they are and what doctors are out there. And by doing that, we've changed the mechanism of time. For instance, taking one doctor who needs to trade, we can now do it in less than 1 minute. We found as much as 2 to 3 hours takes just to do all the paperwork, and we've eliminated that. So time is of the biggest importance, I think, that any administrator or manager should take a look at by utilizing Call Doctor and finding yourself way ahead of the game from especially in today's economic and financial challenges.
Right. Good stuff, Sam. So have an interest in Call Doctor. I'll have Sam Korsmo's email embedded and you'll be able to see that. And yeah, thanks for being here, guys. If you like it, please subscribe and hit the like button, but we'll see you on the next one.
Thank you.
Appreciate it. Yeah, thanks, Sam.